Welcome to USMLE SARTI. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Good morning, good afternoon, everyone. Today we have a very special guest, Dr. Santos from New York, and he has a chain of more than 44 clinics in New York and around, and a lot of Sarthi students have been going to him, and we wanted to set up some time with him to understand what do students do on a day-to-day basis in the rotations, and how does that help them in their residency match. So welcome, Dr. Santos, and glad to have you here.
Thank you very much. I'm happy to be in this conversation and open to help in whatever you need from me. We have been opening our doors since 2018. That's something that makes us very happy.
So, tell us a bit about your background and the clinics that you have.
Good. So I'm a medical doctor from the Dominican Republic, original from the Dominican Republic. Came here in 2015 to the United States, working with a large group of it's a Hispanic IPA, Independent Physician Association, since 2015. In 2020, I started my own project of medical clinics, focus always in serving the poor communities, mostly Medicaid communities, and always on focus in primary care. So our group have grown since we started in 2018, 2020 to 44 clinics, as you mentioned, mainly offering pediatric services, family medicine services, internal medicine services, and women's health services. That said, it's a group of medical providers, including medical doctors, including nurse practitioners, physician assistants, working mainly on preventive medicine.
Okay. All right. So that's very interesting because a lot of students, especially IMGs, are looking into these preventive primary care specialties, peds, IM, FM, women's health, those kind of things. So I think we should start with the onboarding process. So tell us what happens when we send you a student.
Good. So the first step is always going to be an interview. I have been doing this for the last 4 years with different institutions, and the interview process is an in-person interview. It always happens on Thursdays from 3 to 5 p.m. in our main admin office. The interview is a very simple interview just to get to know the student. What is their vision? What is the vision of the students? What is the student is interested in order to go when they go to a residency. If a student wants to go to become a pediatrician, I guess the most important and the focus will be to place them in a pediatrics office so they can get the experience how it works. It depends on the specialty the student is looking for. We're gonna ask also about location. Where are they gonna be living so they can the travel time can be shorter, as much shorter as possible. Also scheduling. We're gonna address the scheduling. We're gonna address the go-to person. So it's mainly the questions of the rotation. Now, also in the interview, we're gonna explain that in our practices, we focus in the modern medicine. So we build our own platform besides the electronic medical record that we use for quality. Our flag, this Basilica group, have been flagged in New York to be very special in quality, and we have become #1 in quality for the last 3 years. So we're gonna be working also on our system and how quality is measured in the state of New York.
Okay. So then let's say the student starts in one of these clinics. What does a day in the life look like? I know you have obviously a lot more clinics and it could vary from one location to the other, but in general, what does it look like?
That is correct. And but we want also the students to learn during the rotation, not just the clinical portion, also the admin portion. Remember that when a student goes into residency, the hospital will focus always in the clinical, which is super important. After they are finished with residency, and they decide to open their own practice, they need to know that's also a business, right? So we focus also in teaching them how to run the business portion and the clinical portion. So the day-to-day will be, first, we're going to start in the room with the medical provider. Again, could be ND and PA. And we're going to go through how we approach the patients, how to build patient rapport, how to do a proper assessment, examination, and how to properly treat these patients, right? We're going to have some time also in the triage room so they can see what happens in the triage room before the patient goes to the examination room with the medical provider. But also, I'm always focused, as I just mentioned in the beginning, the admin portion of the business, of the clinic, right? We want them to have some time also with the the director I have in those clinics, with the front desk. We want the students, to have the experience of each one of the points of that clinic. How is everything run from A to Z for things to be able to happen?
Okay. And, a lot of students ask us in terms of patient interaction, patient management. So what can student expect to learn about, patient interaction, patient management when they are working at your clinics?
Good. In regards of patient interaction, I said during their time in the triage room, in the intake forms and all that, they'll have direct interaction with patients. As soon as they go to the examination room, it will be mostly with the medical provider that we have in that clinic. Of course, there can be a clinical discussion between the medical provider and the student. That way, you can brainstorm, the student can give their ideas to the provider, and have that kind of experience. But until a student doesn't get licensed, the student cannot be by themselves with a patient in regards to go through an assessment, examination, and treatment. But they can be definitely in the room while the medical provider is doing that.
Okay. Okay. So then the other question we get a lot from the
Always with the patient permission, by the way.
Yes, of course. Patient permission is the key. Uh, then we get a lot of questions. Okay, how will this rotation, this experience help me in my residency match, in my interviews, so on and so forth?
Good. So we have affiliation with several hospital systems that they know us. We have been working against since 2018, since 2020, different other clinics. And we give out the letter of recommendation to the patients, to the students, I'm sorry.
Yeah.
And they're gonna be able to upload it in the match system, and the letter, will have our logo, it'll be signed by us. And we have helped a lot of students the last 6 years that we have been doing this. So I guess it will be something beneficial for them.
Okay. All right. And now, have you seen one student, or how often have you seen students do multiple specialty rotations? So one student doing IM, FM, PEDS, or have you generally seen student focus on one specialty?
We've had cases before of students doing multiple. It's not my preference because it's a lot of logistics behind these placements. But definitely we can place a student, for example, for a month in a pediatrics office, and the student want to have the internal medicine experience. I have no problem with going through the process once again and assigning the student to a new clinic. But always we need to follow the interview process, because we want to avoid and bring the error margin as minimum as possible.
Yep. All right. Well, thank you, Dr. Santos. This was great and very helpful, and I'm sure students will benefit a lot from your insights.
Thank you very much.
Thank you.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.